There's a concept called leaning in. Leaning in means that you adapt your interaction style and your communication style with the style of the patient. Leaning in. Kind of like a chameleon, like the lizard, Naren. I'm in Arizona. We have chameleons. You probably know this, Naren, that chameleons have the characteristic of camouflaging themselves in their surrounding as a safety mechanism. So if a chameleon jumps on a green leaf, it turns green. You can barely see it. If the chameleon jumps off the green leaf onto the desert, it turns a mottled brown, and you can barely see it on the desert floor. Well, that's what you're doing. You're changing your colors, in this case, changing your communication style to be the style of the patient. So let me show you how to use this in practical life, and then we'll wrap this up today. So this can be used in everyday interaction in your practice. Let's say your hygienist name is Maria, and her first patient is Bob. And by the way, in the morning huddle, you can go over every patient on your schedule, what their dominant style is, their disc style, as part of the review in the morning huddle, so that you know who you're seeing today. So let's say we know Bob is a high D. So here's how Maria is going to come out and interact with Bob. Bob's sitting in a reception room in your reception office. Maria is going to come out. Say, Bob, it's good to see you today. Come on back. Hey, I have you scheduled until 9 o'clock today. I'm going to make sure that you are walking out of that front door, Bob, at maybe a minute before 9, maybe 2 minutes before 9. Let's go. And we walk back to the room. Okay? Now just hold that aside. Now imagine that instead of Bob, Maria's first patient is Sylvia. And let's say Sylvia is a high I, the people person. So Maria's going to come out to the reception room. She's going to sit next to her in the reception chair. Sylvia, it's so good to see you. When I see you on my schedule, I always know I'm going to have a good day. And I especially like it when you're my first patient. When you're my first patient, it's like sets the tone for the whole day. Hey, what'd you do over the weekend? Oh, you went to the festival? Oh my gosh, I'm going this weekend. What do I have to see at the festival? What should I not miss? And they're going to talk for 30 seconds in the reception room about the festival and Sylvia's weekend. Then she's going to say, come on back. We can keep talking during the appointment. Come on back. Notice the difference, Naren? What would have happened if she would have had that communication with Bob? How would Bob, the high D, feel?
I don't think he's going to be happy, Gary.
Come on, let's go. Let's go. Let's go. I played golf. Let's go. What do you do? I play golf. Come on, let's go. And what if she communicated the same way with Sylvia? And what's Sylvia going to, like Bob, how would Sylvia feel?
She will feel like not having enough information.
What, girl? You don't love me anymore? You're not going to ask me about my weekend? What? What's going on? What's wrong? What's wrong, Maria?
Yeah.
Subtle but different. You get it? And I deliberately use those two examples. They're both on the right side, but notice the differences there.
Yeah.
So that's how when people, when you do this and you master this in your practice, people will say as they leave your office, God, I love it here. You guys really get me. You guys, if they don't say that, they'll be thinking that, which is exactly what you want any patient leaving your office thinking. And how this applies to the drop in the PPO discussion, you're going to end up keeping more of them because they want to go to an office where people get them.
Get them meaning just
they understand. You're like, we're on the same wavelength. You guys get me.
Yeah.
And they don't want to risk that going somewhere else where they'd have to build that all over again, or it might not even happen. They don't want to do that.